Hello.
Hello, hello.
How are you? So, my name is Dr. Amy Shouse, and I'm an acupuncturist, doctor of acupuncture and Chinese medicine here in San Rafael. And I have a clinic called NorCal Center for Integrative Medicine. And with me here today is Dr. Jonathan Smith. Care to introduce yourself?
Sure. Yes. I've been in practice for about 20 years now, and personally, I've had many concussions, so I ended up focusing a lot on concussion for
Hmm.
my own benefit and for my patients, and I'm learning to pass that along now.
Awesome. So yeah, today we're going to talk a little bit about concussion because Dr. Smith is an expert in concussion, having had his own experience with it and worked with patients. I was interested in talking about this topic as well because I have patients with concussions and I wanted to learn more about how to treat them and how what people can actually do to help themselves get better. So, do you want to just kind of dive in
Sure.
and
Yeah.
just
Let's do it.
ask you some questions? So, first of all, um, I guess I just want to ask, like, what is a concussion and what happens to your brain during a concussion?
Sure. Yeah. It's very simple in a way, but very complex in a way. So the simple side is your brain hits the inside of your skull.
Mhm.
And what happens to the actual nerves is that they get stretched, they get twisted, sometimes they get torn and broken. So that in itself causes a lot of problems. But then the secondary issue is all the inflammation that takes place afterwards. And
Mhm.
the inflammation that takes place in the brain is a little different than the inflammation that takes place in the rest of the body in terms of the chemical pathways and the way it's perpetuated.
Right.
That's really the cause of most of the symptoms is that secondary inflammation
That's
in,
right. Right.
in mild traumatic brain injury, which is concussion is considered a mild traumatic brain injury.
Oh, is it? Okay. So
Yeah.
a more severe traumatic brain injury is in a whole other realm,
Yeah.
somewhat.
If you have a skull fracture, or if you go into a coma, and there's a lot of different ways to kind of quantify how bad a head injury is. There's something called the Glasgow scale, and that takes into account how long someone's unconscious. Um,
Mhm.
but basically, with a more severe head injury, you're going to land in the hospital. There's
Got
maybe
it.
some bleeding on the brain.
Right.
It's whole nother level of head injury.
Got
And
it.
in that situation, there is more damage to the brain itself. There's a lot of inflammation as well. So maybe once someone has recovered from the extremely traumatic phase of more severe head injury, then the inflammation will come into play, the ongoing inflammation. But there's a lot more initial damage to the brain that will perpetuate symptoms as well.
Got it. So, what are the most common ways people get concussion that you have seen? And maybe I don't know if you're comfortable sharing your story about how how you had experienced
Sure, yeah,
concussion.
yeah. So personally for me, it was a sports injury. I used to love to do Aikido, which is a martial art, and I hit heads with a fellow in a class, and really was not a severe concussion at all. I had some tinnitus, some ringing in the ears,
Hmm.
and some balance issues a little bit, but it wasn't too bad. But then I was rear-ended about 4 months after that.
Oh,
So that's called second impact syndrome when you have not recovered from an initial injury and you have another concussion. And what that does, it can trigger kind of a higher level of inflammation. So even though
oh,
both of my concussions were pretty minor, I ended up having a lot of kind of long-term I don't want to say severe, because I know there are a lot of people who've had a lot worse symptoms than I have, but they were very very impactful to my life in terms of ability to just go about my daily activities.
Right. So what were the biggest things you noticed with your
I had
condition?
so I speak Japanese, and
Mm-hmm.
I'm pretty fluent at Japanese, and I'm pretty good with French and German, and I do all right with English too. So, but I had a lot of trouble with word finding. I could not
Oh,
speak Japanese at all, and
wow.
and my English, you'd be going along in a sentence, and there'd be like that moment where you're like, what is that word? I know there's a word for this, but I can't think of it.
Mm-hmm.
I had a lot of trouble with short-term memory.
Mm-hmm.
Uh, I had trouble planning things. So there's something called executive function. It's a part of the function of the frontal lobe, and it's your ability to plan things. So it's your ability to put things in order that you need to do them to get it done.
Got
And
it.
I had a lot of problems with that. And I go into the bathroom in the morning to take a shower, and it's like, what do I do first? How do I
Oh,
do this? It's like I'd like wash my hair, and then I'd wash up again, and I'm like, did I wash my hair? I think I washed my hair. I don't know. I'll wash it again, that kind of thing.
oh, wow.
So yeah, it was very frustrating, very confusing for a long time. And you feel kind of not yourself. I had a lot of trouble with my emotions as well.
Oh,
Very volatile in terms of getting very sad or very angry for really minor reasons or no reason. Um,
mm-hmm.
Very difficult for me to read for a while.
Right.
The tracking of the eyes was tough.
I've I've had patients tell me it's really hard to read, especially on a computer
Yeah,
or any
yeah.
kind of digital device.
Hmm. Yeah, that's a whole nother ball game, because the computer, the light that comes from the computer is actually kind of flashing that stimulates the nerves.
Oh,
So one of the issues with brain inflammation is something called neuroexcitotoxicity. So what that means is the nerves, because of the inflammation and their inability to really handle that, they become much more sensitive. So they fire more easily,
mm-hmm.
more often, and they don't recover as well. So it takes less stimulus for the nerves to fire. And
Right.
since they're not firing as well, the connection is not as good. So you hear people say they have brain fog,
Right.
brain fatigue.
Right.
Um, that's where that comes from. It's also where kind of this oversensitivity to light or sound or situations with a lot of stimulus, like if you're in a group setting where there's a
Mm-hmm.
lot of conversations going on, it's overwhelming. Right?
Yeah. Is it because, and you're saying it's because the nerves and the brain are overly excited already because they're inflamed? Is that kind
Yes.
of, and then you
Yeah.
add more stimulation and it's
And
just over.
just a little stimulation will trigger things.
Yeah.
So you end up, in normal life, we have all this stimulation coming in, and we filter it. Our
Right.
brain chooses what's important, what's not. But the concussed brain can't really do that as well. So it tries to process everything, and it just
I
fatigues out.
see. I see. Because that's interesting. So the filter that we normally walk around with is almost just kind of gone.
Yeah,
Gosh, that sounds like it's
it's a bit
terrible.
rough, yes. Yeah, and that also applies to the emotions, right? So
Yeah.
your ability to dampen your own emotions, your own response to things
Right.
is weakened. A large part of the nervous system is about regulating the nervous system,
Right.
not overreacting.
Mm-hmm.
So, somebody cuts you off in traffic, maybe normally you just say, oh, what a jerk, okay, and you let it
Right.
go. If you have trouble regulating your emotions, you might get a little road rage or just hold on to it during the day and
Yeah.
start thinking about it over and over again, something like that.
Oh, that's such an interesting thing that you're pointing out, because my husband has had a couple of head injuries from
Hmm.
a skiing accident, and he was wrestling with someone in high school, and he got dropped on his head, and the
Hmm.
skiing accident happened I think not that long after, where he was actually airlifted off a mountain
Wow.
because he had a seizure. But he's a lot better now. But he used to say that exact thing about traffic. Like, he'd ruminate about someone cutting him off for hours
Yeah.
after like a minor thing, and I was always like, why do you do that,
Yeah. You get into this loop, right?
Yeah, an unregulated loop is like exactly what you're talking about. That's so interesting. That's why he is the way he is. No. But he's better
Explains
now.
everything.
But that's really interesting. So I think I've heard you say, or I read somewhere, that you can have a concussion and not realize it, or you can have like a minor impact
Yeah,
and maybe not realize that you've actually had a concussion.
that's
Is that
true.
is that true?
Yeah, one thing that concussion does to you is it makes you a little less self-aware as well, and it kind of dumbs you down in a way, right?
Yeah,
It kind of puts a space between you and your reality in a way. It's like
okay.
you just don't, you're not as aware. I don't know. It's hard to describe, but I've had a number of times where someone has been like in a car accident, and they'll come in because their neck hurts or their back hurts.
Hmm.
Start asking them questions, and they'll be like, "Oh yeah, I can't really remember that," or um, they're just not as present.
Right.
And you dig down a little bit, and it's like, well, I think you may have had a concussion. I think you may have had a minor concussion, or
Oh,
even a major concussion. Sometimes people don't. I don't think it's really a condition that's known about and talked about enough in common life that you identify it easily.
I
You say,
see.
oh, I've been a little off. I've been sleeping a lot. I've been tired. It's just 3 weeks after the accident. I'm still really tired all the time. Can't
Ah,
focus. I can't concentrate. And they might attribute to the accident, but they don't realize it's a concussion.
I see. Wow, that makes a lot of sense, because we kind of think of concussion as an overt impact to the head in a situation, and you're
Right.
like, oh, you have a concussion, and then
Hmm.
there's an awareness around it being that diagnosed
A
with a
lot of people
condition.
think, and it's a common misconception that to get a concussion, you have to hit your head. It's not true.
Oh, I think, yeah. Okay.
So what really has to happen is your brain has to hit the inside of your head.
Right.
And that happens. So if for example, you're in a car, you're going really quick, suddenly you hit something, you stop hard, the brain keeps moving inside your skull,
Uh-huh.
hits the front of your skull, and then it whips back, hits the back of your skull. Or
Hmm.
you're sitting in traffic, someone rear ends you, your head goes forward, your brain stays there, so your brain hits the back of your skull and then hits the front of your skull.
Hmm. Hmm.
Um, so yeah, a lot of people say, "Oh, I didn't hit my head. How could I have a concussion?"
I
And
see.
that's how really.
Wow.
It's worse if you're turned, because then there's twist to the brain as well. There's torsional forces, and that stretches
Hmm.
out the nerve cells and can tear them as well.
Wow. Okay. That's really good to know, because I
Yeah.
don't, like I said, sometimes you're right. I have seen patients that are very fatigued after a quote minor accident,
Hmm.
even for weeks, and they don't know why. So That's a really good thing to know.
Yeah.
Um,
I wanted to get back to your original question
yeah.
of how concussions happen.
Hmm.
So I think there's a lot of emphasis on sports. And the most common sport is actually girls soccer for concussions.
Oh,
Surprises a lot of people, which is why they've limited like heading. You're not supposed to head the ball,
that's right. I've heard of that. Yeah.
things like that.
Hmm.
So football probably the second. Car accidents, of course, but a lot of the people I've seen with concussion have just had them in their daily life. You
Hmm.
uh, bend over to pick something up, and when you come back up, you hit your head on that cabinet door that was open.
Yeah.
Or another person, well, I've had a couple of people. One person was getting something out of a closet, a pie. I think it was a suitcase, fell on their head.
Oh, wow.
Another person, same kind of scenario on an airplane. Um,
Hmm.
so it can be kind of sneaky, right? You can
Hmm.
have something that seems minor at the time and have some pretty big repercussions from it.
Right. Right. That's that's so good to know. So what should you do right after you've had a concussion, or even if maybe you had a suitcase fall on your head and you just kind of feel like, oh, that didn't feel right, even if it's not,
Yeah,
now that we know it can be even these more minor, quote, minor occurrences. Like, what
sure.
should someone do right after they get a
Well,
concussion?
you wanna try to control that inflammatory reaction.
Hmm.
Um, so it used to be that the protocol for concussion was just rest,
Hmm.
and it is important to rest, both physically and mentally, for 24 to 48 hours. But
Hmm.
what they're finding now is that it's also that resting too long can have a negative impact.
Oh, wow. I did not know that.
Yeah, it's kind of it's always case by case though, right?
Hmm.
So it's hard to just say this is the prescription for concussion.
Hmm.
But you do, in general, I can say you do want to rest for 24 to 48 hours,
Hmm.
which means resting your mind as well. And resting your mind is a lot different than resting your body. If like
It is, yeah.
flu and you're at home sick, you rest by reading books and watching TV and hanging out in your pajamas. It's great. But with a concussion, reading is actually very demanding on the brain.
Right.
Um, and even TV, though it seems very passive, stimulates the brain in a way
Hmm.
that's taxing. All screens will do that. Um, so resting the mind is much different than resting the body.
Yeah.
So
So,
when I say resting the mind, I mean things that are kind of meditative. Going for walks in nature is
oh.
wonderful.
Hmm.
And then once you're past that initial stage, you can start doing some really mellow exercise. So aerobic exercise is extremely helpful,
Okay.
but you don't want to do too much.
You
So you
don't.
have to find your sweet spot of where it's going to be beneficial before it becomes detrimental.
Got
The
it.
reason it can become detrimental is when you exercise, you produce oxidative stress, right?
That's
Which
right.
which can create more inflammation.
Right. Kind of this temporary oxidative stress that we kind of are aiming for that usually, right? To get like this temporary state, and then it goes
Mhm.
down for most people. But that if it's too high for someone with concussion, it can just, the brain can't handle it, right?
Right.
So I mean, yeah.
So what happens sometimes is, I've had several athletes who have had concussions, and they want to get right back into it, or they never
Oh,
want to stop, right? or even, even people who are doing office jobs, but are gym rats, they like to go to the gym and do their 30 minutes on the treadmill or the Stairmaster or what have you.
Mm-hmm.
That up, and they've always felt good doing that. And even when they have their concussion, they feel good doing it. But then 2 days later or a day later, their brain is just all flared up again, and they don't
Okay.
make the connection because some time has gone by. And
Oh, gosh, that's
yeah,
so there can be a couple days of a delay, a day or two of a delay, and then they're
yep,
feeling out of it, and they're not really. So then they go exercise more because they felt better when they
felt good when they
when they
exercise.
were exercising. Wow. So how does one pinpoint like the level of? I guess you'd have to trial and error it a little bit,
Yeah,
or
you just have to start really, really mellow and work up. If you want to work up. What's interesting is that when you exercise, a number of really beneficial things happen. First of all, the blood flow to the brain is very helpful.
mm-hmm.
But there's also a lot of chemicals that get released when you exercise, when you do high intensity exercise. So high intensity means that you would have trouble carrying on a conversation with somebody because you're breathing hard, right?
Yeah.
So doing high intensity exercise for about 5 minutes releases growth factor in the brain, which
Okay.
nerves kind of reconnect.
Okay.
Okay. It also releases endorphins, which just make you feel better,
Mm-hmm.
and it gets the blood flow going, which basically nerves need fuel, either glucose or ketones,
Right.
and oxygen. That's pretty much all they need.
Okay.
With head injury, if you have inflammation, you're going to get less oxygenation just because of the pressure involved in the
In
head.
from the inflammation and
Yeah,
just.
you just don't have good blood flow,
Mm-hmm.
and for the brain to recover, you need to keep that up.
Got
So
it.
exercise is really important. I think the recommendation in most studies for exercise, getting back to exercise, is after the first week.
So you kind of rest for that first week, and
Mm-hmm.
then you kind of, I would assume, figure out your threshold with the Goldilocks, not too hot, not too cold,
Exactly.
exercise
Yeah.
um, regimen for yourself. But as long as you're doing a few minutes of high intensity, that's going to be helpful.
Yeah. I mean, I wouldn't start that until after the first week, at
Yeah.
least. Maybe even after the second week.
Yeah.
But you can get out and walk. You can.
Right.
You don't want to just be sitting around. It
Right.
used to be that the recommendation was, okay, just stay in a dark room for 2 weeks and let your brain recover. Well, it's like for lower back pain, it used to be the same thing. Oh, bed rest. You need to have bed
Right.
rest. And then they found out, oh, bed rest, your muscles atrophy, and it makes it even a more long-term problem. Same with the brain.
Got it. Okay. I did not know that because a lot of my patients with concussion, I can think of one specifically right now who had a pretty severe concussion several months ago. She still
Mm-hmm.
has double vision and she's a lot better, but I think she spent a good many weeks in a dark room,
Right.
many weeks.
Yeah, and a lot of medical professionals are still recommending that kind of approach,
Hmm.
even though the literature doesn't support it.
Right. Right. It's always important to keep up on the newest literature.
Yes.
It's always important to do that, to keep up
Want
on
to
things.
be prescribing yesterday's solution when there's a
Right.
better one today.
Precisely. Um, so we have about, I just want to check the time. So I guess we have about 7 minutes.
Mm-hmm.
Um, so in order to heal, we're talking a little exercise, a little high intensity if we can, but waiting a week or two after initial. So what other things can people do? I know there's probably a lot of things, but briefly, with diet or
Yes.
supplements.
So yeah, getting back to the inflammation part,
Yeah.
that's, there's concussion and then there's post-concussion syndrome. So concussion, you go to the doctor and you say, oh, I hit my head, or I was in a car accident and my head got thrown around and I think I got a concussion, and oh, okay, well, rest for 3 weeks and it'll probably get better, or it will get better. Oh, you'll be fine.
Right.
Um, and in maybe 65%, 70% of the cases, that is true. Post-concussion syndrome means that the symptoms have become ongoing,
Okay.
or chronic. And usually that is because the brain inflammation is persistent. And there's a
Okay.
lot of reasons that brain inflammation can continue. A lot of it has to do with your health before the concussion and your response to it afterwards.
Mm-hmm.
So, as you know, you're a functional medicine specialist. All of us interact.
Yes.
So with the brain being kind of, chiropractors always say that the brain is like the runs the show, right? So all the brain affects all the other systems. All the other systems affect the brain.
Exactly.
So one interesting thing for you to know would be that within 2 minutes of a concussion, the gut barrier actually starts to become more permeable.
Oh, interesting.
Yeah. So we talk about the blood-brain barrier, which protects the brain from a lot of toxins and antibodies. But the gut barrier also starts to break down. So let's say you have a patient who's kind of on the edge in terms of leaky gut. They don't, it's not full blown. It's not really symptomatic, but maybe they've got some gluten sensitivity. They've got a little issue with it that's showing
Right.
in some respects. And then they have a concussion. It's going to get worse.
Yeah. How does that work how does the impact from the head get to all because it's connected with a vagus nerve and innervated together, or?
I think that is the main theory. I don't think it's really, the mechanism itself is very well understood, but it's well observed.
Mm-hmm.
Yeah.
That's so interesting.
So the inflammatory load on the whole body is going to affect the inflammation with the brain as well.
Yeah.
And neuroinflammation will increase general inflammation in the body and vice versa.
Yeah.
So another kind of key part for me was, and for a lot of other people is, sugar regulation.
Yes.
So insulin is toxic to the brain. Cortisol, which is involved in sugar metabolism, is toxic to the brain.
Mm-hmm.
If you have insulin resistance, so that your blood sugar levels are kind of high, your cells aren't able to take that sugar into the cells themselves, so they're hanging. That sugar will attach to other particles. It's called glycolization, and that is also irritating to the brain and the blood-brain barrier. So if your sugar metabolism is out in any way, it's going to impact your ability to recover.
That's interesting because, like this patient I had mentioned earlier, she was pre-diabetic when she got her concussion.
Mhm.
And she was clearly insulin resistant, inflamed before concussion. And what we did was part of the protocol is we reversed her prediabetes.
Nice.
So we've reversed it. She's lost a lot, I think like 40 pounds,
Wow.
but her sugars are much better. And as her pre-diabetic state became reversed, her concussion symptoms have gotten a lot better.
Hmm. Yeah.
Um, so yeah, that makes a lot of sense.
Did you put her on a keto diet
I
or?
did.
Yeah.
I
Yeah.
didn't start her with keto. I started her with, she had other stuff going on.
Mhm.
She was having chronic hives and like allergic, all kinds of stuff. Because one of the reasons she fell was because she went into anaphylactic shock and hit her head
Oh
in the
man.
bathroom, and then got up, fell again, and hit her head again. So hit this way and then hit this way, I think. But so we started her on a very low histamine, and it turned kind of into a carnivore diet, because we were eliminating so much stuff. And then we decided to go full keto for a period of time. And so all of that, you know, helped reverse her pre-diabetic state.
Yeah, ketones are also really good for the brain in terms of it's a better fuel source, kind of burns
Mhm.
cleaner than glucose does.
Right.
So the brain can only use glucose or ketones for energy.
Right.
The ketones burn a little cleaner. It's a less demanding process to produce the energy from
Right.
ketones than it is from glucose.
Yeah.
And ketones also dampen. I've talked about this before, but there's a certain kind of cell in the brain called
Hmm.
microglial cell, which can change after
Right.
a brain injury, after a head injury, and become very inflammatory. It can either be pro-inflammatory or anti-inflammatory. M1
Oh.
state or an M2 state, right? So you want to, as much as possible, you want to shift those cells into the M1 anti-inflammatory state, and ketones. So
Hmm.
that was probably another side benefit of getting around that ketone diet.
Oh yeah. Yeah, that makes sense because shifting the cells, like you're saying, which is makes a lot of sense. And then I know that ketone bodies, as ketones burn, they create less oxidative stress than glucose.
Mm-hmm.
So you're going to have just less of that inflammation metabolically, and then you're going to have it transition the cell. So you're getting kind of two really good effects.
Mm-hmm.
Gosh, that makes a lot of sense. Yeah. So we don't have much time. We have a couple minutes, but can you just say like really quick how you're feeling and what you did to get better? I know that's probably a big long story, but
Yeah. How much time do we have? uh, yeah, I'm feeling pretty good. I'm still pretty cautious about my activities.
hmm.
I used to be a big mountain biker. I used to do Aikido. I don't do either one of those anymore,
Right.
just because, yeah, in addition to those first two impacts, I had several more little car accidents after
Mm.
that, and other incidences where I was either shaken up or bonked in the head that would
Right.
re-flare up a lot of symptoms. And that actually went on for years.
Oh.
I remember the 10-year anniversary of my initial uh, impact in Aikido, and just thinking, when is this going to end? When is this ever going to end?
Yeah.
And there was a point where I thought it would never end.
Hmm.
But as I continued to learn about it and find things to do,
Hmm.
yeah, now I've gotten to the point where I'm feeling pretty good. I
Yeah.
feel like my cognitive sense is where it should be.
Hmm.
One of the last things for me to kind of get over, and I still, I have to be kind of careful about it still, is the emotional reactions to things.
Hmm.
Um, But I think one of the keys for me was doing the exercise and changing the diet. That was probably the most critical.
Yeah. Yeah.
Yeah, I feel like I'm at a pretty stable state.
Yeah.
Where I can handle more, in terms of, I mean, I have a bike now.
Yeah.
and I go
That's
bike
great.
riding.
That's awesome.
Not on trails, but on the road. And
Yeah.
I'm actually going to buy a new helmet this afternoon, a really good helmet this
A really
afternoon.
good helmet. Yeah. And I know you did keto for a while, right?
Oh, yes. I've been doing it for about 10 months now.
Yeah. Yeah.
And that has made a significant difference.
Right. Right.
In my mental acuity and my mood and my wakefulness.
Yeah, and I can attest to that because we've known each other for several years, and we've had we go to coffee together twice a month, about approximately. And I've noticed in the past year, just in conversation, you're just more with it in terms of,
So nice to hear.
remembering things.
Yes.
I mean, not that it was that bad before that I noticed, but I noticed there was an uptick in your clarity. So I've actually witnessed it myself.
And I've always thought of myself as a happy person.
Yeah.
And always thought of myself as having a moderately good sense of humor, at least.
Yeah, I know. That's one of the things I like about you.
And there was a long time where I had no sense of humor, where
Oh,
I was just like,
really? Wow.
just kind of numb, kind of dulled to
Yeah.
the world.
Yeah.
So yeah, it's I feel like I'm, a lot of times you look at places that are designed to help people with concussion, or books. I got every book on concussion, if you ever want a book on concussion.
Really?
But a lot of them are about coping with concussion or coping with post-concussion syndrome. And yeah, that's important. You need strategies while you are healing. But those kind of books kind of imply that you're stuck with it.
Yeah.
And you're not. I mean, not completely. I mean, I don't think I'll ever be that same person I was, 15 years ago, or I guess it was around 17 years ago now that I had my first injuries. Right. I'm never going back to Aikido. I've had to accept that. It took me years to accept that.
But sometimes with books like that, and that's just a mindset where it's like the conversation's kind of over around healing. Around healing, like physical healing, and let's just try to modify our lives. Yeah, it's sort of defeatist a bit.
Yeah. I mean, there is something important about accepting where you are right now.
Yeah.
I
That's
mean,
true.
for everyone, right? Whether you've had injuries or not. But there is a big sense of loss when you've had a concussion and you can't do certain things, or you can't, or you have a change in your sense of your own personality.
Gosh, yeah.
And there's this desire to get back to being that person or doing those things. There's kind of a mourning process involved in that sometimes. So, you ask where I am now, right? So I'm pretty happy with the person I am now and the way I am now. I'm not exactly the person I was before.
Got it.
That's okay, but I'm a lot better than I had been.
Yeah.
So
that's awesome.
Yeah.
That's great.
And I think that possibility, I think one of the questions that we talked about discussing was, if someone has had symptoms for a really long time, is it still possible to recover?
That was
I would say that there is always potential. I mean, I am where I am now, but I know that I have more potential to increase my brain health.
Yeah.
And I'll pursue those. And I think everyone, no matter where they are in the process,
Mm-hmm.
has room to improve.
Yeah, that's great to hear. I love hearing that.
Yeah.
And I believe it. So, do you want to just say where you are and how people can get a hold of you? And
Oh,
I know
sure. Yeah. Thank you.
you treat patients with concussion in your clinic. Um, so yeah.
Yeah, I'm in San Rafael. I'm in the Terra Linda area of San Rafael. My website is balancedc.com,
Mm-hmm.
and I'm putting more and more things about concussion on that site. The way I work with concussion is I do chiropractic adjusting, but very gentle chiropractic adjusting for anyone who's had a concussion.
Mm-hmm.
I do cranial therapies, which is working with the actual bones of the skull to promote the fluid flow around the brain.
Mm-hmm.
But then we do a lot of lifestyle counseling in terms
Mm-hmm.
of what you need to be changing in your life, whether it's exercise or diet.
Right.
Um, and there's a lot of nutrition that can be used
Right.
for dampening brain inflammation. And we talk
Awesome.
about that and find out what's going to be best for you.
Yeah. Great. Awesome. Well, I really appreciate this conversation. It's been one that I've been wanting to have, and I learned a lot. And yeah, so let's do it again sometime.
All right. Yeah, I really appreciate the opportunity.
All right, Dr. Smith,
All right. Thank
take
you.
care.